we're just going into part two now, which is a demonstration. I made this one in 2009. The chap who I'm demonstrating with hasn't had a stroke, is perfectly fine. I just asked him to volunteer just to sit in a chair so I could do a Shak Therapy demonstration just for the video. So please enjoy the video, and any feedback, that'd be nice. Thank you.
Hello and welcome to Shak Therapy. My name is John Green. Over the years, Shak has been developed just by trial and error, basically, and we've fine-tuned Shak into something that everybody can do. Whether you know hypnosis or whether you don't know hypnosis, it's irrelevant. You don't have to understand how the mind works. It does help, but you don't have to understand how the mind works. All you need to do is follow these simple instructions. Everything is done very, very simple. It's done in layman's terms. We like to say it's done ABC 1, 2, 3. If we teach ABCD 1, 2, 3, 4, we say it's too complicated. So ABC 1, 2, 3 is as simple as we need to be with Shak. Now, many people know someone or know of someone who's had some form of stroke or has some form of disability through an accident, possibly maybe a fallen off a motorbike or something. Shak treatment can improve people a lot. It can bring back sensations that these people at one time thought they could not get back again. It doesn't work with every person. It all depends on how the nerves have been severed or not severed. It depends on a lot of factors. But with stroke victims, most times you won't get 100%, but you will get a vast improvement, which is what we're looking for. And that improvement can be improved again and again and again, so you can keep improving on your improvements. So use Shak, and you'll find you can help a lot of people, and they can go away and help other people as well. So what we're going to do is, we've asked Jonathan to come and join us. This is Jonathan. Jonathan is here for the purpose of the exercise. He has no illnesses, he has never had a stroke, his limbs are working absolutely perfectly fine. He's here just so we can demonstrate how to perform Shak. Now Shak works primarily on metaphors, and you need to be able to speak quite lively, quite energetically and very confidently. You can inject humour into the conversation, which does help to alleviate any stresses or any awkwardnesses between yourself and the person who's having the Shak treatment. So what we're going to do is teach you how to use a metaphor. The metaphor we use for the Shak treatment involves a telecommunications system, and as this is going out to different countries in the world, what you need to do is work out a script for yourself to learn based upon your own country. So you'll understand what I'm saying in a minute. When I mention that here in England we have, we're based in Hull as an example, and if I got on a telephone in Hull and I phone someone in Leeds, I may go via a telephone exchange in Pontefract. So as I'm talking to the person in Leeds, the signal is going via a telephone communication system in Pontefract, direct to Leeds. It's all done in a millisecond. So the conversation between myself and the person in Leeds is going via another town, Pontefract. Then all of a sudden, Pontefract telephone exchange blows up. It just explodes. And in a millisecond, you're instantly diverted to Bradford telephone exchange. So you're talking to the person in Leeds, Pontefract blows up, Bradford takes over in a millisecond. You have no idea that Pontefract has blown up. All you know is that your conversation is still being maintained without any interruptions whatsoever via Bradford. Now your mind now starts to understand, send the signal another way. The metaphor is very powerful. Once the mind starts to understand that it can send the signal via where this explosion is inside the brain, the blockage, the mental blockage, it can send the signal anywhere around. And it will automatically start to do that once you've instilled this metaphor. So if you live in America, for instance, you may say, I'm speaking from Florida to Washington via Alabama, and Alabama, a telephone exchange explodes, and you get the picture. So use the metaphor that suits your own country and instill that metaphor into the person, but do it quite fast and energetic and lively. The person will look at you almost with a look of, what on earth are you talking about? That doesn't matter, just keep doing it. It may feel awkward at first, but you know the end results are going to help this person, so just keep doing it. You're actually talking to the subconscious or the unconscious mind. The conscious mind of that person hasn't got a clue what you're talking about. They don't know why you're speaking about telephone exchanges, but the unconscious mind is absorbing this because it's intrigued, especially if you speak fast. So speak fast, lively, energetic, and if you can get a cup of tea out of it, that's even better, right? So get your nice cup of tea, sip your tea, and talk to this person about a telephone exchange. And once you've got this metaphor through, you'll notice in the person sat in front of you a change straight away. Their eyes start to move a lot more, they start to focus on you. But as they're focusing on you, their eyes look like they're going dilated. The pupils get wider, and the head tilts forward slightly, and they sort of look at you upward. Because now they're starting to feel things happening to the limbs that wasn't getting any feeling before. Then we go to part 2. Now the unconscious brain is now working out this fantastic new thing you've just told them, that it can be redirected, they can send signals all around this damaged area. So now it understands it can be redirected. So what we're going to do is send all these signals around the body, and the way we do that is now by touch. Once you instill touch, the unconscious mind is more intrigued. Why is this person touching me? I want to know why. And what you do is you say to the person in front of you, as I'll say it to Jonathan now as an example, his right arm isn't able to function properly. The right side of his face isn't able to function properly. So what I'll say to Jonathan is, on a scale of 1 to 10, if I touch you here on your hand and I tap the hand a few times, on a scale of 1 to 10, give me a feeling, a rate of how much you can feel that on a scale of 1 to 10. Primarily they normally say 1 or 2. So they say 1 or 2. So we'll say, okay, now we need to make that hand the same as this one. Now on a scale of 1 to 10, ask the person again. On a scale of 1 to 10, how can you feel me tapping you on this hand? They'll always say 10, which is fantastic. Then we start to do the magic. The magic is really, really good. We say to the person, well, what I'd like to do is give this hand here the feeling of a 10, like this hand, and tap them, physically touch them. This hand needs to have the feeling of this hand, a 10. So we're going to start to do some magic. And remember before we talked about telephones and how the signals could be diverted? I'd like you to focus your mind onto this hand here and picture that nice feeling of 10, the feeling of 10, how you can feel how clear this is. Now what you do is tap and tell the mind to follow your finger. Tell the mind to follow your finger. Remember, tell the mind to follow your finger. So you say, focus your mind on my finger. I'd like you to follow these feelings and bring these 10 feelings with you all the way around and right through and over, bringing these nice 10 feelings. And as sometimes when you get to about here, the arm that was, or the limb that was quite faulty, may start to jerk in spasms. Don't worry about it, it's just now re-energizing, revitalizing. It will spasm sometimes. And flick and tap and bring those nice feelings of 10 right down to this hand, and the 10 feelings are here. And touch this hand, touch this hand, touch this hand again, touch this hand again. Start to, and inside yourself you can actually picture the balance going on. Now I'd like to ask you now, and you say on a scale of 1 to 10, how can you feel this now? They'll always give you a higher number. So it could be 6 or 7. So we still need to get 10. We'll do it one more time. Say, lovely, let's get these feelings and really, really drum it into them. Let's get these feelings from here and bring them round. And as we're taking these 10 feelings, your mind is going to follow me. That fantastic mind is following me. feeling all these lovely feelings, taking a nice deep breath, feeling re-energized, revitalized, and it's following me right down and right into this hand, starting to feel yourself balancing out, Sometimes the hand will spasm like this, and just let it go for a little while, let it go, spasm, and then say, in a minute I'm going to touch you, and you'll feel it balancing out, feeling good. And just touch the hand like that, and these spasms will start to die down, and the person will start to become quite normal. Whilst this is happening, you may notice the facial muscles have lifted up on people who have had a stroke. So the facial muscles start to raise up without even doing anything. Their tongue, they'll start chewing the tongue if they've had a speech impediment what's followed a stroke. They may start chewing the tongue like this. That's quite normal. It's just that they're getting the sensations back. They're starting to feel the feelings back in the tongue again, and they're starting to be in control of their own tongue. The facial muscles are lifting up. Their eyes start to sparkle. They're looking at you as if you're some sort of a weirdo, which is great. Doesn't matter. Let them do that. So then we say on a scale of 1 to 10, how can you feel that? You'll normally get, after 3 goes, 10. You'll get a balance of both sides. Then we say to the person, I'd like you to rub your face with the defective arm. Right? Don't say it with the defective arm. You want them to rub the face. If they raise the good arm, say no, with the other arm. And they'll rub the face, and they can feel the face. They can feel their arm. It belongs to them again. It's part of them. It is them. It's their arm. The excitement now is getting to both parties. So both of you now will be starting to get a bit excited about what's going on. So now we'll say, okay, so on a scale of 1 to 10, how do you feel? And the person will invariably say a high number, 9 or 10. I always get them on to 10. I keep going until I get a 10. So I've got a 10. Now it's balanced out. The person's starting to feel balanced. Even as Jonathan, even though he's got nothing wrong with him, I'm sure you'll be feeling a difference in the balancing out as well.
I've noticed a lack of clear-headedness.
You get, it's like you just said, it's got a nice clear head. It does work. It relieves stress. It relieves everyday stresses and strains of the day. Do it. Get someone to do it to you. Balance yourself out. Relieve the stress. Take away the strains. Now we've got to this part. Now obviously we need to focus on the legs. But this is where the magic starts. Because instead of going all the way around the body, we can do a shortcut. And you can say to them, now their unconscious mind is now intrigued in you and your voice. And the excitement you're giving, they know fully confidently that you are going to help they're going to help them with the problem they had prior to you arriving at their house. And you just say, okay, I'm going to touch this leg on a scale of 1 to 10, how can you feel this leg? And they'll normally say 2 or 3. Then say, well, we want to make this leg feel as good as this leg on a scale of 1 to 10, how can you feel this leg? And they'll always say 10, because it's the good leg. So good, because we're a little bit of magic now, and this is where the magic starts. I'm going to touch this leg, and you can start to focus that wonderful mind onto this feeling here that I'm giving you, a feeling of 10, 10, 10. But this time we're going to go to this hand here, and we're going to jump across, and your eyes are going to follow me. Follow me with your eyes. Ready? Follow. Whoa. Across here. Lovely. Bringing that nice feeling of 10 down to here. A lot of times there'll be a lot of spasms with the legs, start to spasm. This is as the nerve endings are coming back to life again, and there's energy going into that leg, and it's also attaching itself to the unconscious mind and becoming part of you again, part of who you are. So once we've done that a couple of times, go up like this, jump across and onto this side. The excitement you're giving in your voice is instilling into the unconscious mind. It feels fantastic, it feels great. You must talk fantastic, great feelings, up, 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 up. Everything's up, up. You must be positive in everything that you do. And even in everyday life, be positive in everything that you say to other people. Instill that positiveness in them by talking fast and energetic and being lively. This is what it requires, positiveness. Once you've balanced the person out, just say to them on a scale of 1 to 10, how can you feel this leg? They'll say 10. On a scale of 1 to 10, how can you feel this? 10. Then you say to them, just take a nice deep breath, and I'd like you to stand up and walk across the room. They'll get up and they won't limp most of the time. If they're still limping a little bit, that's only because of wasted muscle tissue, depending on how long they've had this particular condition. But they will improve. Now, a thing what I must stress is if you are on medication, do not, under any circumstances, stop taking that medication. Do not stop taking medication. You must see your doctor, who will take you off the medication at the required rate. Okay? They'll be quite impressed on your improvement, but once you've been on medication, there is a weaning off period that you need to go through your doctor with, and they're the only ones that can wean you off this particular medication. So please, don't think, oh, I feel fine now, I'm going to stop taking the medication. You still need to take the medication that's prescribed to keep the blood thinner, to stop any more clots that may want to form. So please do everything that your GP says. This will make you feel fantastic. It will make you feel a lot better. And in most cases, in a lot of cases, you will see a vast improvement. So do it, give it a week, do it again, give it a week. You will see a lot of improvements. Now the wasted muscle tissue, keep doing the physios exercises. That's all you need to do. So, as fast as I've been talking is as fast as you've just learned how to do Shak Therapy. It will improve a lot of people's lives, and please go on and show other people how to do it. Pass it around the world. More people need to know how they can help other people. Use it in your repertoire if you're a hypnotherapist. Use your own experiences of having had it done. Learn a metaphor that suits your country with the telephones, and go ahead and help other people. Make people happy. Share and care. From me, John Green, thank you for listening, thank you for watching. And from Jonathan, thank you for being a volunteer.
Thank you.
Thank you very much. Bye-bye.
Bye.